Hello and welcome. Today, we're diving into the often overlooked but significant cardiovascular condition known as fibromuscular dysplasia, or MD. This isn't your typical heart disease. It's a unique disorder affecting the arteries, and understanding it can be crucial for early detection and effective management. The exact cause of fibromuscular dysplasia remains elusive. While we don't have a single definitive answer, research suggests a complex interplay of genetic predisposition, hormonal factors, and environmental influences. Some studies point towards a possible link with variations in genes involved in blood vessel structure and function. Hormones, particularly estrogen, are also being investigated for their potential role, as FMD is more prevalent in women. However, it's important to note that having a genetic predisposition doesn't guarantee developing FMD, and the specific environmental triggers are still being researched. Fibromuscular dysplasia at its core is an abnormality of the arterial walls. It's characterized by abnormal cell growth within the walls of medium-sized arteries. This growth leads to a narrowing, or stenosis, of the artery, often interspersed with areas of widening, creating a characteristic string of beads appearance on imaging. This irregular structure disrupts normal blood flow. Reduced blood flow can lead to ischemia, meaning a lack of oxygen supply to the organs supplied by the affected artery. In some cases, the weakened arterial walls can lead to aneurysms, or bulges, in the artery, or even dissections, which is a tear in the artery wall. This can result in severe consequences, including stroke or organ damage, depending on the location of the affected artery. Epidemiologically, FMD is considered relatively rare, but its true prevalence may be underestimated due to underdiagnosis. It predominantly affects women, with estimates suggesting that females are affected up to 9 times more often than males. While it can occur at any age, it's most commonly diagnosed in people between their late teens and early 60s. The most commonly affected arteries are the renal arteries, which supply the kidneys, and the carotid and vertebral arteries, which supply the brain. However, FMD can affect virtually any medium-sized artery in the body. The signs and symptoms of FMD are highly variable and depend largely on which arteries are affected. Many individuals with FMD may experience no symptoms at all. When symptoms do occur, they can include high blood pressure, particularly if the renal arteries are involved. Carotid or vertebral artery involvement might cause headaches, dizziness, pulsatile tinnitus, a whooshing sound in the ears, or even stroke, like symptoms such as weakness or numbness. If the arteries supplying the limbs are affected, individuals might experience pain, cramping, or coldness in the affected limb, especially during exercise. Because the symptoms can be vague and mimic other conditions, a high degree of clinical suspicion is necessary for diagnosis. Diagnosing FMD typically involves a combination of clinical evaluation and imaging studies. A physician will first take a thorough medical history and perform a physical exam. If FMD is suspected, imaging techniques are crucial. These may include computed tomographic angiography, CTA, magnetic resonance angiography (MR), or traditional angiography. These imaging modalities allow doctors to visualize the arteries and identify the characteristic string of beads appearance. Ultrasound may also be used to assess blood flow in the arteries. Catheter-based angiography is considered the gold standard for diagnosis, but it's more invasive and is typically reserved for cases where other imaging is inconclusive or when intervention is planned. While there isn't a formal classification system for FMD based on specific subtypes, it is categorized based on the artery affected. As mentioned previously, the renal, carotid, and vertebral arteries are the most common sites. Additionally, FMD can be classified based on the histological appearance of the arterial wall. The most common type is medial fibroplasia, where the middle layer of the arterial wall is affected. Other, less common types include intimal fibroplasia, subadventitial fibroplasia, and adventitial fibroplasia, where the inner, outer, or outermost layer of the wall is affected, respectively. The specific type of FMD may influence treatment decisions. Treatment for FMD is tailored to the individual and depends on the severity of the condition, the arteries involved, and the presence of symptoms. There is no cure for MD, so treatment focuses on managing symptoms and preventing complications. Medications, such as antiplatelet agents like aspirin, are often prescribed to reduce the risk of blood clots and stroke. Antihypertensive medications are used to control high blood pressure. In some cases, particularly when blood flow is significantly restricted, angioplasty may be performed to widen the narrowed artery. During angioplasty, a small balloon is inserted into the artery and inflated to stretch it open. In rare cases, surgery may be required to bypass or reconstruct the affected artery. Because the exact cause of FMD remains unknown, there are no specific preventive measures. However, adopting a healthy lifestyle, including maintaining a healthy weight, eating a balanced diet, exercising regularly, and avoiding smoking is crucial for overall cardiovascular health and may help reduce the risk of complications associated with MD. Regular follow-up with a physician is also essential for monitoring the condition and managing any emerging symptoms or complications. The prognosis for individuals with FMD varies greatly depending on the extent and location of the disease. Many people with FMD can lead relatively normal lives with appropriate management. However, it's crucial to be aware of potential complications, such as stroke, aneurysm rupture, or kidney damage, and to seek prompt medical attention if any new symptoms develop. Recent research is focusing on identifying genetic markers that may predispose individuals to FMD, which could lead to earlier diagnosis and more targeted therapies. Studies are also exploring the potential role of inflammation and immune system dysfunction in the development of FMD. These advancements hold promise for improving our understanding of FMD and developing more effective treatments in the future.